All right, it's Dr. Buford. Just getting started on the left shoulder. We're looking in from the back to the front. Everything you see is magnified 30 or 40 times on the screen. Your biceps tendons to the right of that blue cannula, and to the right of that is the rotator cuff tear. We're going to see the tear better from a different angle, so I won't spend too much time on it now. The most important thing we've got to do now is secure the biceps for you. And you can see how we pass a needle right through the middle of it. And then here you go. And then through that needle, we're going to pass a black wire called a super shuttle. Hold the camera here, two hands. And then we'll take a grasper. And this is because we're going to be doing what we call a biceps tenodesis, which just means we're going to be securing the biceps. Careful of something. Okay. It means we're going to be securing the biceps in a different part of the shoulder. We'll get to work here and show you some more in a little bit. Pause. Okay, so here's the tear, this little hole right here. We're going to place an anchor in the bone right about here. Go ahead and pull it. You'll see a guide come down in just a minute. It's just a metal tube. And that's what allows us to place the anchor in position. So here's the tube. That's the tear right there. And we're going to place our anchor right about here. So let's go ahead and pull that, put it in. Okay, so here's our triple loaded anchor in position. And now we're going to use our, what we call our crochet hook, just to move the sutures around a little bit. I think we're going to start with this black and white striped suture first. So we'll get this one in right here. Okay. And now we'll just start passing these sutures one at a time. Let me see. Okay, we're all done. Here's the cuff repair. We've got 3 strong sutures tied. There's one in the back there. You can see it right there. There's number 2. There's number 3. That hole's completely eliminated. And we've got a soft tissue biceps tenodesis. So we're going to finish up here and get you back to the recovery room. Good luck to you now. Bye-bye.